Welcome to CounselCast, a podcast produced by the Council of Insurance Agents and Brokers. This is Sandy Laycox of Leaders Edge magazine, and I'm talking with Kim Buckey, who's Vice President of Client Services at DirectPath. DirectPath works with Fortune 1000 employers in employee engagement, healthcare compliance, and transparency. So to start, Kim, can you give us the lay of the land and healthcare consumerism as you see it?
Healthcare seems to be one of the very few things that we buy without knowing the price ahead of time. But if your doctor says you need to have knee surgery, your reaction is generally, okay. Who, what, where, you never think to ask how much. Mm-hmm. Which, is one of the reasons we have the, spiraling healthcare costs that we have. Certainly the more employers and brokers can do to help steer, either provide services to their employees and clients or steer them to where they can get the support they need to make those decisions, the better it is going to be for everybody. We have asked employees for so long to act like consumers and to shop around, but we've never really armed them with the information that they need or the tools that they need to behave like consumers. Mm-hmm. If you're looking at buying car insurance, you can check the ratings of the insurance agencies and you can ask your friends and family what experiences they've had, with claims processing. There just isn't a lot of that information out there, but you can certainly also go online and get a quote, for your insurance. And there are not quite identical, but somewhat similar tools out there that will enable you to easily get an estimate for your prescription drug or a dental service. That information is a little bit more readily available. And if we can get employees and other individuals to take that first step at looking at price and starting to think about making a decision, or making a real educated choice rather than just automatically going with what they're told, that's a step in the right direction.
I read an article recently about how I think it was Blue Cross Blue Shield of North Carolina released a bunch of price information, and the providers around the area said, nothing's really changed, and a lot of the feedback was that people didn't even know what to make of the information. So if it's out there and we're able to do that, how do we get them to use it, understand it, and then engage with it in the way that they need to?
Well, I think there's a level of education and communication that has to go on before we even get to that step. I mean, I know you've read the stories about the lack of healthcare literacy in this country, and when people don't understand concepts like deductibles and copays, how you can expect them to, be able to compare and contrast cost and quality information, it just doesn't add up. So there's a basic level of education that's needed. Again, when you're talking about healthcare, this is something very personal to everybody. I mean, this is your life and your health you're talking about, and it's also your pocketbook. To the extent that you're sharing relative cost information, it helps to put it in a context of, almost storytelling, like using testimonials to the extent that you can, saying, for example, I needed knee surgery. I made use of this service that my employer provided, and there was a $20,000 difference across 3 different hospitals for that procedure. Within the same network, within the same geography, I was going to go here, but instead I went here, and I was able to save $10,000. Mm-hmm. That kind of making it real, making it tangible, I think helps tremendously. I don't know about you, but when I read magazine articles, I always kind of skim them for the little vignettes It just makes it more interesting. And, let's face it, benefits and healthcare is A, very complicated, and B, very boring for most people. To the extent that you can, make it more personal and engaging, the further we'll get with this education process.
There are a number of transparency tools out there. What are you seeing that's effective in moving the dial of consumer engagement?
So, there is certainly a number of organizations out there that are providing advocacy and transparency services. We, of course, are one of them. With some of the organizations such as our own, it's open to everybody. It's vendor agnostic. And the beauty of ours is that it's not just an online tool, which a number of them are. There's a person at the end of the phone. You can call back that person if you have a question at some other time. There's more flexibility in the service hours. And we're drawing on a lot of different data sources, and that's I think, where the InsurTech comes in. Mm-hmm. It's a combination of a proprietary database, actually picking up the phone and calling, hospitals in my geographic area if I have to have knee surgery. And we provide a report to the employee or individual that says, okay, say, for example, again, need knee surgery. I want this one particular surgeon. I could have the procedure done at one of 3 hospitals. Here is the quality rating for each of those hospitals. Here is the cost of those procedures at the 3 hospitals. And we literally did have a case where in the same geographic area, in the same network, there was a $20,000 range in price. Mm-hmm. Using the same surgeon, but at 3 different hospitals. There are several tools online where you can do some price shopping for a particular prescription, and I find it absolutely fascinating the range in cost for the same prescription, from pharmacy to pharmacy to big box to your private pharmacy down the street, insurance versus no insurance versus a discount card. I think it's just really eye-opening once you start playing around with these.
Do you find in your work that you get a lot of engagement in this?
Still a process.
Mm-hmm.
A lot of our clients, came to us because they were very old school and very hands-on, and their employees were used to calling the benefits department and asking questions. Mm-hmm. And in this day and age, the benefits department typically has a lot more on their plate, and while they would love to provide that level of support to their employees, they have bigger fish to fry.
Right.
So it makes sense to outsource that kind of process. But we're a little higher than the industry average in terms of engagement level, mm-hmm. And we're seeing an average employee savings of almost $200 per procedure, and the employer is saving almost twice that across the board.
How are brokers becoming more engaged in cost transparency discussions?
Oh, I'm certainly seeing more and more brokers going out on site to their clients and holding meetings with the employees. So certainly any level of support that can be provided, and that is ideal. It's a shift in selling. You're not selling to the client, you're selling to the employee. Mm-hmm. So there's still an element of sales. I mean, we in the industry have been saying for years that the way to get employees or individuals to focus on benefits is to market to them, to sell to them, not just, provide options and, hope for the best. So to the extent that, they can focus on, selling a service or selling the benefits of a service to the employees, everyone benefits. And particularly, I know one of your questions was around self-insurance. I mean, mm-hmm. Organizations that are self-insured probably have the most to gain, with this kind of information out there, because as the employee saves, so do they. And I think many, employers don't know where to start either. So if their broker can come to them and say, we can all benefit by the cost saving that might be generated by using a service like this. Have you considered looking into it? There are some options.
Mm-hmm.
I wouldn't necessarily wait for, the client to come to them.
How can employees begin to have these conversations with providers?
In an ideal world, we'd see providers being a little more sensitive to costs and willing to, at least address alternatives.
Mm-hmm.
But, I think in today's environment, certainly, as a provider, you don't know what your patient's insurance coverage is. That's handled by the back office. Your focus is on the person's health. So I think part of it is educating the individual to ask the right questions, like, okay, your doctor says you need knee surgery. You as the patient shouldn't just say, okay. You should be asking questions like, why? Is there an alternative we can try first? I have budget concerns. How can we work around that?
Mm-hmm.
And lead to start the conversation and increase awareness on the provider's part.
Where do we go from here?
I've been in the business for almost 40 years, and every 5 years or so, there's the new magic bullet. Back in when I first started working, everything was an indemnity plan. Mm-hmm. And then it was, managed care is going to be the solution, or mm-hmm. HMO is going to be the solution, and consumer-directed plans are going to be the solution. And it's not going to be just one plan design. It's not going to be just one part of this big puzzle. It's not the employers that are going to solve it. It's not the providers who are going to solve it. It's not the insurance companies that are going to solve it. It's everybody. Mm-hmm. Doing their part, and we're moving in the right direction. We're just not there yet.
So what do you think we need to do to get there?
Well, I'm encouraged at the level of conversation I'm hearing now about educating the public into becoming real consumers. I think finally the light is dawning that, increasing cost sharing and pushing more onto the individual, we probably hit that wall that we can't do much more of that. Mm-hmm. So there are other things we need to do, and it's not going to be just plan design, because that's not going to really change behavior. In order to change behavior, there has to be a level of understanding. And it just seems to me that in the past year or two in particular, we're just seeing more and more stories about the lack of healthcare literacy, and the reason high deductible plans with HSAs are failing is a lack of consumerism or true consumerism, or lack of understanding about how these plans work. So I think now that conversation has started, that is in the huge step in the right direction. When the ACA put summaries of benefits and coverage in, that was maybe a misguided step, but that was, maybe the first step in that direction, to help, get employees or individuals thinking about, I can compare between options. In that case, it's comparing between coverage options. Now we have to take it down a level to comparing service options. Any
final thoughts?
Well, my personal soapbox is the healthcare literacy, which you probably picked up on. We buy healthcare services without even thinking about the price. When you have a prescription, you go to the drugstore closest to you, even though, the one across the street might actually be less expensive. Mm-hmm. And it's just something that we're not conditioned to think about. So, the more all of the elements of this industry can work together to get people thinking about that, I think we'll start seeing the change in the right direction.
That was Kim Buckey of DirectPath talking with us about healthcare cost transparency and employee engagement. Thanks for listening to CouncilCast, the podcast of the Council of Insurance Agents and Brokers.